Hi, Assalamualaikum, and thank you for joining my online presentation. For this evening, my name is Muhammad Haris bin Zulkifli, and I am a student of Bachelor Medical Imaging and HSR 3A, and my topic is about coronary artery disease. If you have anything to ask, kindly ask during our Q&A session at the end of my presentation. Okay, for my presentation, I will go through one by one by starting from the introduction, and after that, we will go through regarding about the etiology and also sign and symptom for coronary artery disease, and we will go through about the complication, and after that, I will explain regarding through the imaging modalities and also the radiographic appearance, and after that about the treatment and prognosis, and the lastly we'll talk about the conclusion. Okay, for introduction, cardiovascular system consists of heart, arteries, and capillaries. There are two main coronary arteries, right coronary artery and left coronary artery. The function of coronary artery providing blood supply to myocardium. Anomalies of the coronary arteries can be congenital or acquired. What is coronary artery disease? A condition where coronary artery narrow or block due to the plaque buildup. In medical term, we call atherosclerosis in the vessel lumen. Cardiovascular disease is also known as coronary artery disease, has remained the leading cause of death globally. In 15% of 109,164 medically certified deaths were caused by coronary artery disease. Okay, now we'll go to pathophysiology of CAD. Coronary artery disease is a caused by the narrow or blockage of coronary arteries due to atherosclerosis, often triggered by factors like high blood pressure, smoking, high cholesterol, and diabetes. Endothelial injury allow a low density lipoprotein, or we call LDL, cholesterol to enter the arterial wall, leading to its accumulation and oxidation. Oxidized LDL trigger inflammation, attracting the monocyte that become the macrophage. This macrophage engulf the LDL and forming a foam cell and creating a fatty streak. The fatty streak grow as a small muscle cell migrate and proliferate, forming a fibrous cap. This cap stabilizes the plaque but can thin and can become vulnerable over time. Vulnerable plaque can rupture, exposing a material to the bloodstream and leading to thrombosis, a blood clot formation. The thrombus formation can reduce or block the blood flow to the heart, causing ischemia, or we call chest pain or angina, or myocardial infarction, which is heart attack in severe cases. And next, we will go about sign and symptom. This is the sign and symptom for coronary artery disease. For the first one is shortness of breath, or we call SOB. Occurs when the heart struggles to pump the enough blood, leading to insufficient oxygen delivers to the tissue and lungs. Next one is heart palpitation, which can result from irregular heart rhythm, can cause by reduce of blood flow to the heart electrical system. And next is heart arrhythmias, which is irregular heartbeat, may occur part of the heart muscle do not receive enough oxygen. For the symptom is chest pain or angina, which is a hallmark symptom of CAD, and can caused by a reduced blood flow to the heart muscle during the physical exertion or stress. And next one is 13, which is the heart inability to pump efficiently leads to a lack of oxygen supply to a muscle, tissue, or causing an exhaustion. Next one is nausea, a common during episode of angina or heart attack, especially in women. And after that is sweating, which is a cold sweat. Cold sweat can occur due to the body's stress response during the reduced blood flow or heart attack. And the last one is dizziness, result from the insufficient of blood flow to the brain due to the compromise of cardiac output. Okay, now we will go to the complication of coronary artery disease. For the first one is myocardial infarction. Occurs when the coronary artery becomes completely blocked, cutting off the blood supply to the part of heart muscle leading to the tissue death. And next one is angina pectoris, which is a chronic chest pain or discomfort due to the reduced blood flow to the heart, often triggered by the exertion or stress. And after that is heart failure, which is a weakened heart may result from a long term of CAD, where the heart cannot pump effectively to meet the body needs. And next is arrhythmias, which is irregular heart rhythm can develop due to the damaged tissue or disrupted electrical signal, potentially causing the symptom or leading to a complication. After that is cardiac arrest, which is a sudden loss of heart function, often due to a severe arrhythmias like ventricular fibrillation caused by extensive damage to the heart muscle. And then we have stroke, which is a CAD increase of the wrist blood clot forming, which can travel to the brain and cause ischemia stroke. And after that is a sudden cardiac death, which is a catastrophic event often caused by a severe arrhythmias or a massive heart attack, leading to immediate loss of heart function and death if untreated. And the last one is peripheral artery disease. It's atherosclerosis in the other arteries. For example, its legs can develop alongside of CAD, causing a reduced blood flow and leading to a pain, ulcer, or gangrena in the affected limbs. Okay, next we will talk about the underlying factor of CAD. For the first one is smoking, which is damage the blood vessel, raise the blood pressure, and increase cholesterol, all of which can contribute to the CAD. And the next one is diabetes. A high blood sugar damage the blood vessel and increase the plaque buildup in the arteries. The third one is lack of exercise, can lead to obesity, high blood pressure, and poor heart health. Fourth one is alcoholism. Heavy drinking raise the blood pressure, cholesterol, and triglycerides, and also increase the CAD of risk. The fifth one is unhealthy diet. A diet high in fat and sugar can increase cholesterol, blood pressure, and weight, leading to a CAD. And the next one is age and gender. As you age, your risk will be increased. And for gender, men are more at risk early, but women risk rise after the menopause. The seventh is high cholesterol level. It is too much bad cholesterol leads to plaque in arteries, narrowing them and increase the CAD risk. And the eighth is hypertension, a high blood pressure. which can damage the arteries over time and accelerate plaque buildup. And the last one is family history. Genetic can make more prone to developing CAD, especially if close family member had a heart disease. Okay, now we will go to the image modalities for this present for this sorry. For image modality, we will use 4 types, which is conventional radiography, angiography, cardiac MR angiography, cardiac CT angiography, and invasive cardiac angiography. For conventional radiography, the advantage is the most effective, simple, and inexpensive tool. Can only detect the present or absent only, without considering its extent, non-invasive, and shows signs suggestive to CAD complication. For disadvantage, it has low sensitivity, unable to visualize coronary arteries, and unable to access the blood flow. Now we'll see about the image appearance. As you can see, the aortic arch calcification was seen as a small white area at the aortic knob in the anteroposterior chest view. It divided by 4 types. The first one is grade 0, which is no visible calcification. The second one is grade 1, which is small one spot of calcification or thin calcification in the aortic arch area. The second one is grade 2, which is one of more areas with thickened calcification. And grade 3 is a circular calcification of the aortic arch, which is AAC is due to the buildup of the plaque. Next, we will go to the cardiac MR angiography. For advantage, it has no radiation exposure, non-invasive procedure, soft tissue differentiate, and suitable to the patient that have a contrast allergy. And it also has a high resolution image. For the disadvantage, it has limited expertise and availability, which means that not many hospital or place that has this type of machine. The second one is it take a long time to scan. The third one is involuntary muscle movement can cause an artifact. And the last one is low spatial resolution. For image appearance, there are no significant disease in the left anterior descending coronary artery. The projection is LAD. And as you can see in the image of A and also B, or right coronary artery in the position of RCA, and the image is C and D. However, there is an occluded left circumflex artery coronary, which is the image of E and F. As you can see, I have marked it with the red arrows. Now we'll talk about the computed tomography angiography. The advantage of using this machine is it has a high sensitivity and accuracy and non-invasive procedure. It is also fast and efficient modalities. For disadvantage, it has a high cost and limited availability, high radiation, and high risk for renal impairment. Renal impairment refers to the condition where the kidney are not function properly, resulting in reduced ability to filter the waste and maintain fluid and electrolyte balance. It can range from mild dysfunction to a severe kidney failure. Okay, for image appearance, as you can see in the left image, you will see the white matter which is plaque will cause the stenosis or narrowing of coronary artery. And at the right, you will see that there are 5 types image. From the left one, you will see it is a normal, the absence of plaque and no luminal stenosis. And the next one, you will see it is a minimal, which means the plaque with below than 25% of stenosis. The middle one is a mild, which is plaque with 25 to 49% of stenosis. And the next one is moderate, which means 50 to 69% of stenosis. And the last one on the right side, which is severe, which means 70 to 99% of stenosis. Okay, next is invasive coronary angiography. The advantage of using this machine is a gold standard. Next, it is highly specific and sensitive. And the last one is a real-time image. For this advantage, it is an invasive procedure. It has a high risk for complication. And the last one is it has a high radiation for the patient. Sorry. Okay, next one is the image appearance. For the image appearance, on the left one, you can see it has a white arrows show the 90% of narrowing in the right coronary artery. In the middle one, it is a normal coronary angiogram in a young health patient. And the right side, it is a coronary angiogram in the middle age of patient complaining for a brief episode of angina pectoris. Note the significant stenosis of the left coronary arteries. For rationale, the first one is conventional radiography. The chest X-ray might provide a valuable information as an early detection of CAD. The next one is invasive cardiac angiography. Although for being invasive, it still remains as the gold standard of imaging method. And the next one is cardiac CT angiography. It has a high effectively test that can be implemented as a first-line modality due to the ability to provide anatomical and physiological information at the same time. And the last one is cardiac MR angiography, one of the best modalities due to its contrast-free and free from the radiation. Okay, next is treatment and prognosis. For medication, we have statins, which is the medication most commonly used to reduce the production of low-density lipoprotein cholesterol. It is recommended as a first line for CAD prevention in patients. The next one is aspirin. Aspirin helps thin the blood and prevent the blood clot. Daily low-dose aspirin therapy may be recommended for the primary prevention of heart attack or stroke in some people. And the last one is PCSK9. It is inhibitor a cholesterol lowering medicine. They work by decreasing your level of low density lipoprotein cholesterol. Okay, next we will go to the treatment revascularization. As you can see on the right image, it is a coronary angioplasty and stent placement. A tiny balloon on a thin tube called a catheter is used to widen the clogged artery and improve the blood flow. A small wire mesh tube called a stent may be placed to keep the artery open. This treatment opens the clogged blood vessel in the heart. Most stents are coated with the medicine that helps keep the artery open. Okay, next, as you can see on the left image, it is a coronary artery bypass graft, also known called as CABG. This is a type of open heart surgery. During a CABG, a surgeon takes a vein or artery from somewhere else in the body. The surgeon uses the blood vessel to create a new path for a blood to go around a blocked or narrow heart artery. The surgery increases the blood flow to the heart. Okay, for conclusion, a coronary artery disease remains a leading cause of morbidity and mortality worldwide. In order to detect CAD, imaging modalities crucial role in the diagnosis, risk of stratification, and management of CAD. Each modality has unique strength and limitation, making them suitable for different clinical scenarios. The first one is non-invasive technique like CCTA and CMRA are preferred for initial evaluation in low to intermediate risk patients. And the second one is invasive coronary angiography remain essential for heart risk case or when revascularization is planned. Okay, that's all from me. Now we will open the Q&A session. If anyone want to ask something, you can ask now.
Hi,
Yes.
I have a new question. First,
Okay.
why a man prone to get CAD than woman?
Okay, I repeat your first question. Why men's are prone to get CAD than women, right?
Yeah.
Okay. Okay. One of the reason is because men tends to store fat around their abdomen and the visceral fat, which is linked to increase the risk of CAD. But and women, in the other hand, typically store fat around their hips and thighs, which is less harmful for a heart health. Okay.
One question. Can statine reduce the risk of the heart rate, heart attack or stroke?
Can statin reduce the risk of heart attack or stroke, right? Did I got it? Did I get it the question correct? The answer is yes. Statin can reduce the risk of heart attack and stroke and other cardiovascular event by lowering the cholesterol level and reducing the inflammation in the arteries. Statin help prevent the plaque buildup and the formation of blood clot, and of which can lead to the heart attack or strokes. Okay.
Okay, understand. Thank you.
Okay, welcome. I will end my presentation. That's all from me. Thank you.